Hi, can you put out a multiple trauma call to A&E Resus now, please?
I'm part of a legacy of BAME workers who have helped create and sustain the NHS for over 70 years.
These 6 young ladies are from Pakistan and they're student nurses at London's Mile End Hospital.
Since its inception, tens of thousands of us have devoted our careers to the NHS and have been proud to do so despite enduring racial inequalities within the organisation. I fear what seems to be the excessive death toll amongst BAME staff during this pandemic may yet be another sign of that injustice. Osman, a doctor at Northwick Park Hospital, has recently recovered from the coronavirus. He contracted the disease at the same time as his father. Dr. Adil Al-Tayr didn't survive.
There was a part of me that thought, no, he's not quite unwell enough for this to be fatal. We were getting daily updates from the hospital, but again, I didn't imagine that it would be so sudden.
Osman fears his father may not have been properly protected and worries about a continuing shortage of safety gear in the NHS.
Everyone who's going into work knows that they're essentially putting themselves at risk of picking it up, but the fact that we've had any deaths to frontline staff in the first place was too much.
Why we have a higher death compared to non-ethnic background is because we're on the front line. So right now, where I'm working, everybody is from an ethnic background.
Margaret Barron has worked for the NHS for 2 decades and says things have never been bleaker than now. Recently, a colleague and friend of hers died after contracting COVID-19.
Food lovely, roast beef.
I worked with him for 17 years on a rehab unit. He was lad's lad, so cheeky Tom. He attended his patients, he gave them 100%.
Of course, they don't know that.
Goodmayes Hospital says there were no symptomatic patients on the ward where NHS healthcare assistant Thomas Harvey worked. But his former co-worker, Margaret, believes he might still be around if he had been provided with the right protective gear.
I remember myself calling Thomas and asking him if he had a face mask I could have. And he said that they didn't have any PPEs, they didn't even have the basic face mask.
The scarcity of PPE is particularly worrying for ethnic minority staff because these communities are known to have a higher prevalence of medical conditions which increase the likelihood of suffering severe COVID-19 illness. These health outcomes can be the result of socioeconomic factors, and there is concern that the recently announced government inquiry won't address this.
I'm glad that the government is looking into this, but I don't want this to be a report which goes on the shelf, right, and we'll be looking at it. I think what the pandemic has shown has been the inequalities have been exposed. And people who are really dying are the ones who are the front line, who are low-paid jobs, as I said, and a majority of them represented by the BAME community.
I believe the NHS has an increased duty of care towards vulnerable BAME staff who might be exposed to the virus through their work. And if the government inquiry into the excess death toll amongst the BAME community finds that that duty of care wasn't exercised, it would be a failure of those in charge to protect their staff.